Labiaplasty surgery involves resection of some skin around the labia minora, which sometimes can be too large and protrude over the neighboring labia called labia majora. So if you have a protrusion, some of that skin can be resected, and there are various types of doing that resection. Either you can just trim the edge, or you can take a wedge out of the labia, depending on the clinical findings. For a labiaplasty, it depends a little bit if you will have it done under local anesthetic, where we only numb the area, or whether you prefer to sleep. Depending on that, the day will pan out a little bit different. Either way, after you've arrived at the hospital, we will see you in the clinic. We will discuss the surgery with you again and take your informed consent a second time. And we do some marking at the area we're going to resect. Afterwards, we bring you to theaters. You will either be awake or asleep, depending on the type of anesthetic. The procedure takes roughly 60 to 90 minutes, depending on how much we need to resect. Afterwards, you will come back to the recovery room. And again, depending if you had a general anesthetic, it might take you an hour or so before you can have a drink. Under local anesthetic, you usually can have a tea straight away and go home an hour or two after the surgery. Labiaplasty is surprisingly well tolerated. Firstly, we always use local anesthetic for this procedure. So when you wake up, you will have a numb feeling and there will be no pain. And this will last for several hours. Afterwards, you will feel like as if you've cut yourself in the kitchen. There will be a little bit of tenderness at the area, but it will not be extremely painful. There will be some swelling, and that can be a little bit uncomfortable for the first couple of days after the surgery. Following a labiaplasty, the first 5 to 7 days, there will be some swelling and sometimes a little bit of bruising. The recovery is usually very well tolerated, and it might take some people even shorter than the 7 days. I normally recommend not to do any too strenuous activities in the first 7 to 14 days, and sports activities to take that also slightly easy. Also, sexual intercourse should be refrained from for potentially 2 to 3 weeks. Labiaplasty resection is permanent. So once you have resected the skin, it will not grow back. However, with aging, everything gets a little bit thinner and the skin can become lax again. So there might be some laxity of skin long-term, which can be addressed with other procedures, such as fat grafting. Usually a second type of labiaplasty is not needed. Yes, there will be scars at the resection line, but this type of scarring is almost invisible and very little complications with the scarring. Sometimes the scar can be slightly less sensitive and sometimes a little bit more sensitive in the first couple of months after the surgery.